Hello, my name is Samantha Rangel. I am a registered nurse in the Acute Care APN program, and today I will be presenting on a mobile app that I find to be very helpful in day-to-day lives of my future patients, especially those with chronic conditions. The application that I chose is called MediSafe. This is a medication management app. It provides tailored information about medication lists and the related health problems. It is also an adherence tracker that tracks the percentage of doses a patient is taking within the week, month, or year. What I particularly liked about this app is that patients can also get information about their medications, medication interactions, and the diseases that are requiring them to take these medications in the first place. So, why did I choose MediSafe? Well, medication tracking applications are important tools for patients to utilize in day-to-day life. One of the things that providers need to know when caring for their patients, whether that be in the clinic or in the hospital setting, is the patient's current medication list and adherence to their treatment plan. Furthermore, this application provides detailed information that the patient can carry forward in all encounters. This makes them more of an active member in their treatment plan. Specific information is included about the purpose of each medication while the patient is putting in the information. Patients can specify and select why each medication is being prescribed so that they have further understanding. For patients with chronic diseases or with just a lot of medications prescribed to them, sometimes it's nice to be able to select why each medication is being prescribed by their provider. It helps their understanding and it helps everyone's understanding in all the different areas. Once the patient has the diagnoses listed, patients can elect to learn more about these certain disease processes if they want to. It can also tailor exclusive areas of interest to the patient. It almost provides a for you information page about their medicines or their disease processes. Patients can also add specific treatment details and get refill reminders or just have any specific instructions for each medication that they need to remember. Then going forward, it will pop up every time that medication pops up. So, why is all of this important? There are multiple studies that have looked into mobile apps and medication adherence and chronic diseases. The first one is by Boshian et al., which did a study on mobile apps and asthma patients. The digital tools like mobile apps and smart inhalers are crucial for asthma management. The information tracking really improved patient adherence, and information provided in the applications ensured correct inhaler technique. It kind of reinforced education that providers were already giving their patients. Another study by Ruiz et al. Involved patients that were type 2 diabetes patients and found that the mobile health apps, especially those that employed behavioral treatment strategies, have proven effective in improving patient adherence to self-management goals, which in turn led to a significant positive health outcome, such as improved glycemic index and reduced cardiovascular risk factors. Another study looking at mobile health apps was by Al-Arki et al., and this just found that patients who had a boost in medication adherence through mobile apps, like via reminders or educational support, had a trend of positive patient health outcomes, including improvements in their blood pressure and overall quality in life. So there are definitely research studies out there saying that these medication adherence trackers are important and lead to positive patient outcomes. So what does using MediSafe look like, and how easy is it for you to navigate? This is your home screen once there are medications entered, and only the medications that are taken regularly will be present. At the top of the screen, there is a plus button. It has a drop-down menu, which allows you to add a new medication, invite a MediFriend, which is a friend or family who wants to participate in reminders for medications, refills, or appointments. You can also add a diary entry where a handwritten note can be typed out. There is a health tracker entry, which is the part that I was really interested in, which will lets you write down how often certain symptoms are happening to you. It will provide a graph or table entry of what those symptoms look like, how bad, and so on. And there's a dose for all of your PRN medications that can be added. At the bottom, there's also a manage screen, which brings a similar report if you forget about the plus button. Medications, reports as far as adherence, health trackers and measurements, which is kind of what the tracker entry is, any handwritten diary notes, or any health contacts that you want to add to be able to remember. Entering a medication is pretty easy as well. You will get a drop-down list, and you can slowly either start typing the generic name or the brand name for the medication. And the first thing it'll ask is what form is the medication. It'll give different options for different meds, and it will ask what the strength is for the med. After that, it will then ask you why the medication was given. It will also ask how often the medication is taken, if it's daily or if it's as needed. And all of this is in this format where you just get a drop-down option list and you can easily select from the following options. My results were kind of all over the place. I am not exactly regular with taking all of my medications at a certain time. You will see it will tell me quite a bit that I have taken medication at certain times during a day, and it tries to get me to have more critical alerts so that I never miss a dose, because that was actually more of a problem than I thought it was going to be. I thought I was going to be much better at adhering to a strict medication schedule, but that was not the case. So my personal adherence report, which was found on this page under reports, you can see that my weekly adherence was pretty terrible with a 61%. Especially, there were certain weeks where I fluctuated, but it really showed me that I was pretty terrible at adhering to certain medications like I should have. And it definitely gave me more of a reality check and more strict reminders. And now that I have critical alerts on my phone, there's no way that I'm going to forget. Now, the most interesting results that I was particularly focused on were the symptom managements or health trackers. I take sumatriptan for migraine, and my provider has made it very clear that I need to let her know if I am having more than 4 migraines a month. So depending on what your symptoms are, you get a whole list of health trackers that you can add, whether that be blood pressure, whether that be a certain caloric index, certain blood sugars are on there, symptoms, dizziness, chest pain, anything like that you can enter into this application and then add each entry. Since it was a migraine, it gave me a pain scale, and I was easily able to track by week, month, or year how many migraines I were getting and how badly they were. Not only was I documenting how often I was taking the sumatriptan, but then I was easily able to see, okay, this is how many symptoms I've been having a month, and I can pull it out in my next appointment with my provider, which just helps all around because we were trying to decide whether or not I needed different migraine medication. This is where I found it the most helpful for me, and I'm sure she probably thinks the same, given that I'm able to give a more detailed explanation, and we kind of pinpointed when in the year is this happening for me personally. Does it correspond with anything? Has anything happened? It just helps me remember, since I only see my provider once every 6 months. As a provider, it's important to think about how I would use this application. Medisafe gives patients an opportunity to not only record adherence, but also gain easy access to more information that reinforces teaching, as well as certain health trackers, which is very important whenever you're dealing with symptom management and how effective treatment plans really are. For any patients afraid or intimidated by the application, I would start by providing the most basic information first, getting them comfortable, starting simple, and focusing on the medication tracking aspect primarily. I would also use visual aids or a tutorial video. Metasafe does have tutorials on YouTube. They have their own YouTube page. There isn't a whole lot in the application itself, but there are ways to get user-friendly guides. I have some small recommendations on how to improve the app. First would be modifying a dose given. The ease of doing that right now is just about impossible. You have to delete the medication entry and start over. I really wish there was a way to click on medication entries and edit the time or date given, but that is not the case for right now. The in-app user friendliness is another aspect that I wish that they would either add some tutorials or add a little guide if people wanted to watch it in the application itself rather than just having them go to YouTube. The last improvement that I would recommend is the ease of sharing data with healthcare providers. As it stands, the data can just be emailed to the healthcare providers as an attachment. There really is no way to access the data as it is shown in the application. You just have to kind of email an attachment to a provider that wants it. I think overall, some final thoughts. I would use this as an app for my patients. I think it would be helpful, especially for patients who have chronic health conditions and take a lot of other medication. But other than that, I think it's a very helpful application, especially for patients that are confused as to why they take so many medications. And that concludes my presentation, and here is a list of my references. Thank you so much.